Today we're learning more about the 56 jobs cut from the KDHE earlier this month. As 13's Callie Holthouse reports, more than half were cut from the same area of KDHE. Callie.
Yeah, Victoria, over half come from the arm of the agency tasked with preventing and managing diseases. Not only is KDHE feeling the funding squeeze, so are the agencies it administers grants to. An open records request by 13 News found that of the 56 jobs cut from KDHE, 29 come from the Bureau of Disease Control and Prevention. Several grants administered by KDHE were terminated in late March, resulting in the loss of millions in funding for health agencies in Kansas. In Osage County, the local health department will lose access to about $50,000, though it had no plans to use those funds, resulting in a net zero impact. The Riley County Health Department will lose $25,000 it had earmarked to expand services.
While we do immunize in northern Riley County, it's not something we do as frequently as we would like. And that was really our intention, was to really leverage those funds.
Nikki Ramirez Jennings wasn't surprised to learn funding cuts were on the horizon. She leads the local Health Equity Action Team, or LHEAT, in Northeast Kansas.
We knew cuts were coming. I didn't know exactly ours were coming, but it was something, we anticipated.
LHEAT's work is centered around improving public health outcomes by addressing social factors. It lost approximately $1.8 million in grant funding.
We did everything from literacy kits to free financial literacy classes, gathering luggage for the youth that are connected to KVC. We wanted to be an organization that was giving resources, but also seeking understanding of why the resources needed so we can go back up to help minimize, why it was needed.
Without that funding, she says LHEAT will lean into its community partnerships, and additional members are now working on a volunteer basis.
That says a lot about the people that are at the table as well and why they're in it. And they're in it to win it for everybody, not just for themselves.